So I'm grateful for this day. I'm grateful for Neighborhood Technical Assistance Clinic for launching the first of this annual walk. It's important that we raise awareness around this issue. It's something that, in 2012, the Emeagwali Foundation put out a report where we did a landscape of the city and discovered through our research that Black maternal mortality was an issue way back then, and yet still we are here. And since the inception of the Emeagwali Foundation 38 years ago, we have prioritized funding for reproductive justice and health equity, especially for Black women, whose problems and challenges are often ignored, and the solutions to those problems and challenges have often been underinvested. But as we gather here today on the first day of Black Maternal Health Week to take action, we need to recognize that just being a Black pregnant woman should not be a crisis. So we can no longer ignore that in New York, Black birthing people experience worse maternal health outcomes and lower rates of preventative health services than their white counterparts. Nearly 3 out of 4 pregnancy-related deaths are preventable. We can no longer ignore that access to reproductive health care is shrinking in New York City. Earlier this year, 2 sexual and reproductive health centers in Brooklyn closed. They serve people from Bed-Stuy, Brownsville, Crown Heights, East New York, Flatbush, and Fort Greene, providing culturally competent care for Black women and girls. We can no longer ignore that many of the health disparities stem from structural racism, such as residential segregation, community disinvestment, income inequality, lack of healthy food access, and affordability threatening the health and well-being of people of color. We can no longer ignore that racial inequities in maternal health often persist regardless of education or income, pointing to systemic issues beyond socioeconomic status. Black women and birthing people experience implicit bias and discrimination, barriers to preventative prenatal and postpartum care, underlying chronic conditions like lupus, disparities in healthcare quality and patient experience, overuse of cesarean deliveries, and providers failing to address serious complications. And we can no longer ignore that less than 2% of all U.S. giving funding goes to women and girls charities, including those focused on maternal health and reproductive justice. But imagine if things could be radically different, right? What would it look like to have coordinated care before, during, and after your pregnancy? Imagine having doulas and midwives that support women and birthing people. Imagine having care that is culturally appropriate and meets the needs of Black pregnant people. Imagine that we collect data that centers the experience of Black people. Imagine if we combat systemic racism. So what should we do? As I said before, the Black maternal health crisis is not new. The problem is in fact growing, and we must respond and act with a sense of urgency to prevent another Black life lost. We must listen to Black women, center their voices, their expertise, their lived experiences. We must trust Black women, uplift and amplify the community solutions that they know work, right? And we must fund Black women who are advocating, organizing, holding the hand of a pregnant woman, providing doula and midwifery support. We must support and fund quality maternal health care for Black women and birthing people. One of the things that we like to say at the New York Women's Foundation is that problems and solutions exist in the same place. Let this be the gathering that we begin to end the Black maternal health crisis in Brooklyn and beyond.